A month ago, Texas ended its mask mandate. And 2 days ago, like 30,000 people crowded into Global Life Field for the opening game of the Texas Rangers. Is the fourth surge about to happen? And in Florida, minorities and poor people are getting less vaccinations than the rich. Is it a pay-to-play scheme on the part of the governor? It's not as black and white as you think. It's Rob Nelson Live. All right. Hey, everybody. Happy Wednesday. Welcome to Rob Nelson Live, streaming at you from our virtual studios in Los Angeles and Neptune Beach, Florida, and to you on whatever social platform you're on, from Facebook to YouTube to Reddit to TikTok. Love your comments, your feedback, your interaction. Be part of the show with us. Let's get right to it. Wow. 2 days ago, Texas Rangers, Global Life Field, like 30,000 people packed in. TMZ had a nice little picture to show. Crafty, can we see that pic? There it is. Look at that. Fans pack in Ranger Stadium. What? Social distancing? Look at those people. That's an actual shot from 2 days ago. Thanks, Crafty. That's 2 days ago in Texas. I mean, you know, the mask mandate ended a year ago in Texas, a month ago, sorry, in Texas. The Governor Abbott, no more masks required. You can't even make people wear masks. And people have been saying, like, it's going to go south. I mean, we're going to see a massive fourth surge around COVID. But has it happened? It's been a month. And here's the thing. And again, the way we look at COVID has a lot to do with our politics, sadly. I know we say it's the science, but both sides say it's the science, and both sides cherry pick their facts. But here's the thing. I'm trying to just be straightforward even on this whole thing. Here's the actual numbers in Texas. The 7-day weekly case average, March 9th, the day before the mandate was ended, was 3,971 cases. 2 days ago, the 7-day average case count was 2,815 cases, like a 50% drop. There were 126,000 active cases of COVID in Texas on March 9th before the mask mandate was ended. There's 97,000 right now. Again, a drop. And 104 deaths in the 7-day average dropped to 81. Clearly, it's been a month. The massive numbers, you should have started to see a surge by now. A month's plenty of time. Will the crowds at Texas at the Texas Rangers game change that? Will that be like a shift? I don't know, maybe. Although you didn't see it with the crowd surrounding Tampa Bay. In Tampa Bay, you didn't see a surge in Tampa after the Super Bowl. I don't know. I don't understand why lockdowns don't seem to have the effect they're supposed to have. What I do know is the highest numbers of infection in the U.S. are in Michigan. Michigan, a state which has held closely to incredible, I mean, other than the governor violating her own rules, having her husband go try to get them on a boating trip when she told everyone to stay home. They've had some of the strictest lockdown policies in the country, from mask mandates to keeping businesses closed, and their numbers keep going up. Why? I don't have the answer why. I have all kinds of theories I put out there. All I know is Texas numbers are going down, despite the fact that they have no mask mandate, despite the fact that they've been opening up. Florida the same way. And Michigan numbers, New Jersey numbers, keep going up. But here's the thing. Governor Whitmer in Michigan, who's been a hardcore, like, toe the line, has said, I am not putting more restrictions in place. She's like, not happening. We're in a push and pull, a tug of war right now between the administration, which is trying very hard to drive a hard line. Don't move too fast. The CDC, don't open up so fast. Take your time. And states, Democrat and Republican, who are saying, we are opening up. California is set to go full on open, 100%, no more restrictions by mid-June, 100%. Granted, Gavin Newsom's worried. He's got a recall election on his hands and he wants to win. I mean, science is all important until politics steps in and suddenly the science isn't as important. But Whitmer's the same way. She's like, we're not putting more restrictions in place. And here's the problem. Biden and his administration want them to slow down. I'm not sure why. I don't know if they really think that there's going to be a fourth surge, even though so many people are getting vaccinated, even though the variants maybe, but they are determined. And in a speech on Tuesday, the president reiterated this, saying, guys, we can't move too fast. We are still in a life or death race with this pandemic. And then he reminded us that by the 4th of July, we might be able to have small gatherings again with our friends and family in our backyards. Now, remember when he said that like a month ago, and I made fun of it, and a lot of people did? He doubled down on it. He didn't go, you know what, guys? I was a little wrong in my estimation of how open we could be. He said it again by the 4th of July. We should be able to be having small gatherings with our intimate friends and families. Crafty, can I see that picture of Global Life Field again? Look at these people. There are like 10 people wearing masks. Like, look in the middle, like you'll see some people with masks on. There's no social distancing. There are no masks. There are 30,000 people packed in that stadium. Thanks, Crafty. I mean, which part of by the 4th of July? And it's not just Texas, and it's not just Florida. It's everywhere. Governor Whitmer said it. People are tired. They are going out. President Biden, you need to recognize that no matter how much you want to tell people something, your message is way off base. We're not going to be having small gatherings with friends and family by the 4th of July. Get with the program. I don't care what state you're in, what your politics are. We're having small gatherings with friends and families last week. We're having every single city's opening up baseball games to at least partial capacity. The Mets, the Yankees will have 12,000 people in the stadiums. 12,000 strangers. Get with the message, because you're way off message. And as much as you want it to be something, that doesn't make it what it is. That said, and by the way, 2 recent polls, mid-March Gallup poll, 35% of people surveyed, regardless of their politics, said they're not worried about COVID. That is a huge, huge decrease from what it was just a month ago. It's like a 15% drop, not to mention what it was a year ago. Monkey arms, there's no evidence that vaccinations are the reason for the plateau of infections. I would agree. Vaccinations aren't the reason for the plateau of infections. I mean, I would say that's absolutely true. We haven't had time yet to see that. I'd say the plateau of infections has to do with a whole lot of other things, which I've been saying for a while. I think we have a partial herd immunity. I think people who have been outside and doing things tend to not get as infected as easily. I don't know if it's the vitamin D in the sun. I don't know what it is, but all the people, I know people who've never left their house like hardly at all in like 9 months, and they got COVID. They don't even know how. I also think it's that the sicker, older, especially the older population that was most vulnerable, and nursing homes got it widespread, and younger people tend to get it, show less severity, probably aren't getting tested as much, are healthier with it. So you're seeing numbers go down for a whole lot of reasons. But, and by the way, a second poll, the Marist poll last week, 25% of people, not just conservative Republican men, 25% of people across the board say they would not take the vaccine even if offered to them. If given to them, they would be like, no. So you got a serious problem if we need to hit 80, 90% to get herd immunity. I don't know that we do, but it's a serious issue. And let me just say quickly, I think there's a lot of reasons for this. There's so many contradictions. We've done this, both sides, we've done this. We've polarized this issue. We made a deadly global pandemic, blue and red in America. And we've picked sides based on our politics, and both sides have stuck to it. No matter what, we've stuck to our sides. Tyler, thank you. Every epidemiologist is warning about another surge. Yes, they are. At the same time, Tyler, if you look, a lot of epidemiologists are saying they don't think it's necessarily going to happen. They're worried it could happen. And the nature of being an epidemiologist, I always like to refer back to Dr. Fauci a year ago saying, I go farther than I need to. I hope people look and go, I was too cautious. You're an epidemiologist. Your job is to look at the worst case scenario, how this could happen. And yes, there could be a fourth surge. I'm going to say right now, Tyler, I don't think there's going to be a fourth surge. That said, I think there's a lot of reasons for that, but I'm not discounting that there could be. And I want to be very clear. I'm not discounting that getting I think, despite what Monkey Arm said, I think getting the vaccine will keep the surge from happening. But again, let me just touch on this, the contradictions, because it makes people not know what to do. You know, I go to the gym here in Florida, and they have a requirement to wear masks when you walk around, just like when you go to restaurants. It's this stupid thing. Put a mask on when you walk in the restaurant, take it off when you sit down at your table. It makes no sense. It's like get on the airplane, socially distance 6 feet apart, but then sit 6 inches from somebody for 5 hours. Yes, you have a mask on. But notice at the gym, people take their masks off when they work out. They're allowed to, and some people don't wear them at all. I tend to keep mine on. But everybody wipes down their equipment. 100%, they wipe everything down. I see these people with no masks on wiping down all their equipment. And I'm thinking, this is an airborne disease. I said this 9 months ago. You're not going to get it touching something. The CDC finally this week came out and said 1 in 10,000 chance that you would get COVID by touching something. 1 in 10,000. They're like, it is almost not transferable by contact. It is an airborne disease. Yet you got people going in, wiping everything down. I know people who still wipe their food down. So people like literally have no longer know quite how to make sense of this. And I think the contradictions, the hypocrisy on both sides has made people just not know what to do. And they're just plain fed up. As Governor Whitmore said, people are over it. They're fatigued. They want to go back to their lives. A good point, analysis paralysis. Wiping down equipment was suggested before COVID, but I've been going to gyms for years, and I'll tell you, some people wipe stuff down, some people didn't. When you go to the gym now, people wipe down and they're asked to wipe down every single piece of equipment before and after they use it. It's everybody wiping it down. It's just a sidebar point. Let me move on, because here's what I really want to get with this. What I think we have, monkey arms, the opening of gyms is not dumb. And this is the point. You're very stuck on the one side of this. There's no reason not to be in a gym. To be honest, I've been in gyms. There's far less people in the gym than there used to be. People stay distanced apart from each other. They have equipment space, so you can't use equipment right near someone. Most people are supposed to be wearing masks, and many are. Things are being wiped down, as analysis paralysis said. And the reality is it's one of the cleanest places. Monkey arms, that's like when people say flying is a bad idea. Flying is probably one of the safest things you could have done, especially when the middle seat was open. Airplanes have incredible ventilation systems. Everybody's wearing 1-2 masks. You know, you're not unsafe in a plane. And you're not unsafe in a gym. And here's my point. You are more at risk in a grocery store than a gym, monkey arms. Trust me. You haven't been in gyms. I've been in gyms for the last 6 months, and I've been in grocery stores for the last 10 months. And there are far more people packed in behind me and around me in the grocery store than there are at the gym. Far more contact, all kinds of places than I get at the gym. All right, to where I want to go with this. I always get so wound up in the beginning and I lose time, so I'm going to speed up. What is true, no matter what, is that Black, Latino, and Native Americans are 3 times more likely to die of COVID than white people. There's a whole lot of reasons. People have put socioeconomic reasons out, how many of them are essential frontline workers, certain health conditions, nutrition issues, hospital care, and overall long-term health care, and the lack of adequate preventative health care in poorer communities. Whatever the reason, they're 3 times higher, more likely to get it. And yet, and healthcare workers, by the way, are Black healthcare workers more likely to get it and have worse consequences than white healthcare workers. And yet, we do not vaccinate. The number of vaccinations in minority communities, Black, Latino communities, is tiny compared to the white communities. And this issue blew up on 60 Minutes last week because Governor DeSantis was accused of getting a $100,000 donation last year or whenever from Publix, a grocery store chain in Florida, and then awarded Publix the right to distribute the vaccine over other grocery stores. And 60 Minutes went hard with it, that he had done a pay for play. And for those of you on the left, I'm going to take DeSantis down for what he's done here, but I'm all about fairness and factual accuracy. So here's what 60 Minutes had to say.
Publix, as you know, donated $100,000 to your campaign, and then you rewarded them with the exclusive rights to distribute the vaccination in Palm Beach. So first of all, what you're saying is wrong.
How is that not pay to play?
That's a fake narrative.
The criticism is that it's pay to play,
and it's
Governor.
Wrong. It's wrong. It's a fake narrative. I just disabused you of the narrative, and you don't care about the facts.
All right, now for all you Florida haters and you DeSantis haters, just take a break and hold on. I am not giving DeSantis some green light pass here. Florida, Palm Beach County, this is a month ago, but Palm Beach County is 40% Black. and it had a 4.5% vaccination rate for Black people in a 40% Black county. Florida has done a terrible job of making sure minority communities have gotten adequately vaccinated. But before I get into that, the factual or accurateness of what happened with DeSantis, 60 Minutes had a narrative. They wanted to go with DeSantis is a Republican. He got a contribution. He gave Publix, the grocery store, the ability to distribute a vaccine and give it mostly to white rich people. Oddly enough, the blowback came from Democrats, not just from Republicans, because the mayor of Palm Beach County, and before you think, well, Palm Beach, that's like rich people. Palm Beach County is not all rich people. The Gold Coast is rich people. Palm Beach County is a big county and has a huge minority population. And sadly, the majority of the minority population is poor. The mayor of Palm Beach County is a Democrat. And he said that this was an intentionally false lie on CBS 60 Minutes part. He said, we told you before you aired, we told you that is not what happened. We told you the governor did not try to give this to Publix. We went and asked Publix to do it for our county. And we went and asked the governor if that would be okay. I want to read you just an excerpt of his letter. This guy's a Democrat mayor of Palm Beach County. Here's a piece of what he said. Let's just go to the clip, Crafty. That's his letter. That's his letterhead. I watched 60 Minutes and feel compelled to issue this statement. The reporting was not just based on bad info. It was intentionally false. I know this because I offered to provide my insight into Palm Beach County's vaccination efforts, and 60 Minutes declined. They know that the governor came to Palm Beach County and met with me and the county administrator, and we asked to expand the state's partnership with Publix to Palm Beach County. And then he said this. And this is where it gets interesting. We've confronted this pandemic for over a year. Our residents, like all Americans, are tired, and the media is making it worse. They are hell-bent on dividing us for cheap views and clicks. 60 Minutes should be ashamed. So this is one piece of this I want to get to before I get into the full-on with the vaccine issue, which is, I've said it before, I'm going to keep saying it. The media wants us divided, guys. So I don't care if you're on the left or the right. They're dividing us, and the more we stay divided, the more they win. And anybody who thinks 60 Minutes is fair, I mean, again, living under a rock. I've been on 60 Minutes. I was actually profiled on 60 Minutes. And I sat inside the White House with David Gergen, a presidential advisor, as 60 Minutes filmed us. And when we finished the interview, one of David Gergen's aides came in and pointed to a mask on the wall, which was a caricature of Reagan and a caricature of Nixon, their faces in grotesque form. And she said, that's in the shot. It's going to make you look bad. It's going to make the president look bad. This may be a small detail, but just goes to show you. David Gergen picked up the phone, called the producer of 60 Minutes, said, I need that shot fixed. And he said, no problem, done. Power moves things when it comes to media. I built a political campaign and I watched my reputation go up or down depending. I had editors, people literally write stories about me and completely distort everything. I had Newsweek trashed me in a piece and they made stuff up like crazy. And I called the writer. I'm like, you made that up? And she's like, I didn't do that. The editors did. She didn't even deny it. You know, politics and media work in a strange way, and 60 Minutes had an agenda. Sadly, they helped DeSantis. They didn't hurt him. They helped him. You want to help that guy get reelected? You want to help that guy become president? Keep doing what you're doing, 60 Minutes. But it pisses me off because it's the divisive narrative that keeps hurting us. And then secondly, just quickly, I want to show you the director of federal emergency, Boyden. DeSantis does not get a pass. And I want to be clear. Let me skip over what the emergency director said. Let me just move ahead here. He doesn't get a pass. I think Florida has done a horrible job of giving the vaccine out to people in poorer counties. Ocala County, which is just south of Orlando, has a 1 in 10 infection rate, 4% vaccination rate. North of Sumter County, north of Orlando, has a 1 in 16. So like 50% lower infection rate, a 15% vaccination rate. Florida has done a terrible job. I don't think DeSantis is out there trying to help minorities and make sure they get the vaccine first. I don't think that for a second. I also don't think it was a pay-to-play move giving Publix the drug. Publix was the only store that could distribute it adequately at the time, and the Democratic mayor of the county went and asked for it. That's my problem with the media's depiction. I'm not saying DeSantis gets a pass. I don't think DeSantis is out trying to help minorities. And I don't think Florida's done a good job. I mean, in the 10 highest income counties in Florida, 10 times higher, double vaccination rate of the 10 poorest counties in Florida. So don't get me wrong. DeSantis isn't getting a pass from me. I'm not defending DeSantis. I'm saying 60 Minutes and anyone on the left who wants to just keep sticking knives in DeSantis for political agenda is only helping him. DeSantis hasn't done a good job making sure this vaccine gets into poor minority communities in Florida. Absolutely not. It's got nothing to do with the pay to play. It has to do with where their priorities lie. And their priorities don't lie with poorer, lower income people. They lie with more well-off communities, donors of whatever color, and often white people. But here's my point, Tyler and others who think I'm giving him a pass, because I'm not. He's done a crappy job. That doesn't mean 60 Minutes is right in making up a false narrative. I don't like that either. It doesn't help, just keeps dividing us. But my point is the disparity's not unique to Florida at all. It's everywhere. The top 4 states with the biggest vax disparities between minorities and white people are Florida, not in this order. Connecticut, number 1, Florida, New Jersey, and California. California has a 50% disparity. Twice as many people, or half again as many people who are white get it as people who are black get it. In 65% in Connecticut. It's the disparity between white and black people and rich and poor and minority and non-minority communities getting. It's got nothing to do with Florida. Sadly, poverty is not a partisan issue. We've made it one, but it's not. Black communities, and by the way, this is in the cities too. DC, which is the most democratic city in America, double the rate for the richest 4 wards versus the poorest 4 wards in the city. Chicago, the highest COVID rate in the city is in a majority Latino zip code. They have the lowest vaccination rate. USA Today did a study citywide, black and Latino zip codes versus white, 3 times as high vaccination rates to the white communities as to the minority communities. This issue is not about whether you're a Democrat or whether you're a Republican. It's about our lack of willingness to look and deal with those who are minority poor communities. I agree with you, analysis paralysis. Binary positions aren't helping us. But the problem is we don't call people out on issues when they deserve it or not. We call out the people we don't like, the other side, on issues when they do something wrong, and we defend the people on our side when they do it right. That's my point with DeSantis. I'm not defending him. I think he's done a terrible job, but I'm also not going to go with the narrative that he intentionally did it as a payout and somehow look here again as an example of Florida, Republicans helping white people over black people. DC, Chicago, California, same disparities, same horrible disparity between black people and white people getting the vaccine. Why is that? That's the issue. Why? First, white privilege. White people get it. They did a vaccination drive in Pahokee, Florida, and it's a 85% black Latino community, 13% median income, so poor. Right? And they found that most of the people there were white people. They didn't live there. They'd driven 50, 60 miles to get there to get the vaccine. Like literally, they went and got it. There's been poor messaging. There's been poor accessibility. There's been a terrible job of getting it out. Secondly, we don't distribute based on where the most cases are. We haven't distributed the vaccine going, who has the most COVID? Let's give you more vaccine. Even states have gotten in fights about this, going, give more vaccine to the people who are getting it the most. Don't just give it, on this, equalitarian sort of standard, right? Then another thing, the 65 plus tier, which made sense at a certain level, but Lisa Cooper, who's a Johns Hopkins Center for Health Equity, and she has a MacArthur Genius Grant, made a great point. She said, you get it at 65 if you live to 65. Life expectancy in the black community is lower, so you probably should be giving it to black people who are 50 and over, because that's 55, because that's comparable to white people who are 65. But we don't do any of those things. We don't focus on putting it, frontline workers, more minority than white. Why didn't we make it a priority? And I've said this before, give frontline workers the vaccine first. Give them the vaccine right off the bat, right away. No. So again, you want to make it left and right, go ahead. But what we're really doing is ignoring the real issue, which is poor, underserved communities get mistreated every time by Democrats and Republicans. Democrats have controlled major urban cities for decades, and they haven't done crap to fix their problems. Their economic infrastructure, their broken schools, their terrible hospitals, their horrible job conditions, 0, 0, 0. Nothing. Rahm Emanuel moved into Chicago, didn't do crap. I know Rahm Emanuel from the Clinton White House. You know, he's a political genius, but he couldn't fix Chicago. I mean, it's not one side or the other. Poverty's not partisan. We're screwing over poor people. We're screwing over minorities. We're not giving them attention. And then we politicize it to be right on our high horses. I'm right, you're wrong. So look at bad Republicans. Look at good Democrats. Look at horrible socialist Democrats. Look at great Republicans. And we just keep screwing the people in the middle who are getting hurt every day and could care less about our partisanship. And then finally, there's vaccine hesitancy, and that is a real thing. Let me play a little clip of Wendy Williams on talking with Dr. Oz.
Wendy Williams says there's no way she's getting vaccinated.
No, I don't trust it. There, I said it. I don't trust it. I've never gotten the flu shot either, though, and you and I have talked about that, and several of the doctors on my team talked to me about, Wendy, we'll get the flu shot. I've never had the flu. I'm not getting a flu shot.
I was stunned and flabbergasted when she told me that she wasn't going to get vaccinated. She's thinking about it, but she's a very firm, opinionated woman, as you know. And I think she speaks for a lot of women in the Black community.
I don't want to make too much. I do. I don't want to say vax hesitancy is the main reason why Black people aren't getting it, but it is a reason, and it is a big reason. And it can't be, again, I want to say white privilege, people with money, their ability, and I use white privilege loosely in that term, but I mean the ability of white people to get what they want, people with more money to get what they want, the horrible messaging to reach into inner city and more impoverished communities, and the fault of governors and leaders, city and state leaders, Republican and Democrat, to make them a priority because they're not priority voters and they don't give a lot of money, so they don't come to the top of the list, are all reasons. But vax hesitancy is a real one. And Wendy Williams speaks for a lot of Black people. Let me just show you a couple tweets in response on her thread. I'll just run through a couple of them for you. We'll just whip through them. Yeah, Wendy, that's right. Melanated people don't do it. We know their history and their pattern. She's referring, we'll just keep going through them, Crafty, because I know our time. I don't blame her not trying to be a lab rat. And for everyone that took it, may the Lord be with you. I'm with Wendy. Dr. Oz tried to convince her, but sis said what the fuck she said. Love Wendy. She's my kind of girl. She probably has Tuskegee in mind. Okay, that's enough. That's enough of them. Thanks, Crafty. So point is, they're all referring to a similar theme. They're all Black people referring to a similar theme. Don't trust the government. Tuskegee, when they experimented on Black people, there's a deep distrust to the government. You know, there's a deep distrust to the government from Black communities, especially when it comes to medical stuff. So here's the thing. You know, if you're on the left and you're cheering and enjoying, and if you're the mainstream media and on the left of center and you're having a blast watching yourself go after Republicans and making conservative white Republicans go conspiracy crazy. Oh, see, they want us to have a vax passport because they're going to track us to the end of time and it's socialism and they're taking over. It's 1984. And you laugh and you go, woohoo, look at those conservative Republicans losing their brains. Good. You can go get off and have a good time on seeing Republicans go nuts. But you know who else does that? The very Black minority, poor communities that you think you want to help. Because in the Black community, they're doing the same thing. People are like, the more you tell me I have to do it, the more I distrust you. Because I don't trust the government. I don't trust what they've done with drugs. So you're actually in driving this narrative that we drive. You have to get it. You have to get it. Absolutely get it. We're going to ignore all evidence that we might be safe without it. Get it and don't go out. You know, I get why they're messaging it. They want everyone to get it, but they're actually making people more hesitant to get it. Not just conservative white Republicans. They're making Black people more hesitant to get it, who already have a distrust around trusting the government with injecting them with things for very good reason. Tuskegee and other examples. So, you know, when you stop and think about it, what's more important? Is it your politics, your ideology, or what your agenda, or what you actually say you really care about? If it's the latter, if it's what you really care, if the real goal is, let's get minorities vaccinated. They're the highest risk of dying. There are a huge number of them essential workers. They're already living in impoverished communities, living in poverty. Let's get those people vaccinated. If that's the goal, that's the agenda, and it really is what you want. You don't win anything by going, let's make a fool out of DeSantis, who's doing a terrible job of making sure minorities get it. As I said, most state governments, you know, New York, California, Newsom, you know, all of them, and city leaders, Mayor Lightfoot in Chicago, you know, the mayor of DC. If that's what you really care about, then let's focus on that. Let's focus. And again, poverty's not partisan. If we want to fix the poverty problems in this country, which we should, and there's a lot of white poverty too, but if we care about impoverished urban communities that are mostly Black and Latino, let's put the resources there. We're not going to put it there by creating this artificial divide. It's like, you know, my agenda, my ideology over yours. It's going to take everybody coming together. It's going to take innovation. It's going to take flowing real resources in, and it's going to take bringing this level of distrust down. Our partisan hate fest, maybe making us or some people feel better in a pandemic era, but it's devastatingly harmful to those most in need in this country. I'm Rob Nelson. Thanks for watching.